So in my practice, I offer patients surgery when other less invasive or conservative treatments have not been effective. Joint replacement surgery, whether it be a half a knee replacement called a unicompartmental or a total knee replacement, is major surgery, and the patients need to be counselled and have the correct expectations. So in my practice, treatment is offered when patients' symptoms are very severe, quality of life is affected, and pain is also present at rest. It's quite miserable if a patient can't sleep at night, or if they can't sit and enjoy a meal, watch TV, watch a movie because of pain in their knee. If other treatments have failed or not been effective, then that is an indication at that stage to offer a joint replacement.